Nigeria Center for Disease Control confirms COVID-19 cases have risen to 46. Vice President Osinbajo tests negative. Coronavirus test kits arrive in Nigeria as Lagos begins disinfecting bus stops, motor parks. In international news, Prince Charles contracts coronavirus. And in sports, Man City manager Guardiola donates €1 million to fight coronavirus.
This is ANN News.
I am Olajumoke Olatunji. Nigeria has announced 2 more new COVID cases, bringing the total number of confirmed cases to 46. The Nigeria Center for Disease Control says the new cases were reported in Lagos and Osun State, which has just confirmed its first case. NCDC says both cases were detected in travelers who returned to Nigeria in the last 7 days. As it stands, Lagos has recorded 30 cases, Federal Capital Territory 8, Ogun State 3 cases, and 1 each in Ekiti, Oyo, Edo, and Osun. So far, most top infected people have recently returned to Nigeria from high-risk countries. Meanwhile, the federal government says it has intensified contact tracing to track those who might have been in contact with infected persons, some of whom have already been found and have tested positive for the virus. Vice President Yemi Osinbajo has tested negative for coronavirus. ANN had reported earlier that Chief of Staff to the President, Abba Kyari, had tested positive for the disease. Kyari's COVID-19 status led to suggestions that other members of the Federal Executive Council be tested. In a text message, the Vice President's media aide, Laulu Akonde, says Osinbajo had undergone a test for COVID-19 and that the result is negative. Not so lucky, though, is Bauchi State Governor Bala Mohammed, who has tested positive for the virus. Mohammed says that he boarded the same flight and shook hands with son of Nigeria's former Vice President Mohammed Atiku Abubakar, who has tested positive for COVID-19. A statement by his spokesperson, Mokhtar Gidado, reviews only the governor tested positive out of the 6 samples, including those of his aides collected by the NCDC. Nigeria's share of the medical supplies donated to African nations by the founder of Alibaba Group, Jack Ma, has arrived in Lagos. The country received 20,000 test kits, 100,000 masks, and 1,000 medical-use protective suits. The donations entered the country in just under 24 hours after the Nigerian government lifted a ban on cargo flights coming into the country as a result of the spread of the virus. 3 states, Lagos, Edo, and Osun, have adopted similar measures to contain the spread of COVID-19. Governors of the 3 states have ordered partial closures of all markets and stores for the next 7 days with effect from Thursday. Lagos Governor Babajide Sanwo-Olu gave the order as Lagos begins a process to disinfect bus stops and motor parks in the state. Announcing the market closure in Edo State, Governor Godwin Obaseki said only food vendors, drug sellers, and other vital commodities will be allowed to operate. Obaseki also reduced the number of people allowed in any public gathering in the state from 50 to 20. The governor disclosed Edo's government is working with a specialist teaching hospital for mass production of hand sanitizers for distribution to local government areas, palaces, markets, and other government agencies for use in public places. Osun Health Commissioner Dr. Rafiu has announced an indefinite suspension of weekly markets to curb COVID-19 spread. Only daily markets will be allowed to operate. Rivers and Ondo governments have also announced similar measures. Meanwhile, the Lagos State government has urged the private sector to take drastic steps like in the public sector and allow non-essential employees to work from home. The governor also asked banks and other financial institutions to prioritize online channels for their services to the public. The federal government has intensified its directives of strict screening of all passengers who use facilities at the airport. The Aviation Ministry said the directive was issued to airline operators and agencies in order to curb the spread of the deadly coronavirus. The ministry says without exception, all persons entering any domestic or international airport terminal must undergo temperature checks and hand cleansing with sanitizers before being allowed to board any aircraft. It says all airline operators have received the directives and must comply. The Nigerian Army will embark on a special operation that includes enforcing the restriction on movement and compulsorily moving sick persons to hospitals. The operation, tagged OP Second 11, has been sanctioned by the Chief of Staff, Takai Buratai. A memo by the Army Chief of Policy and Plans, Lamidi Adeosun, directs the suspension of all Army projected events for 2020 of events that involves large gatherings. Those includes meetings, briefings, and conferences. It said with the recently recorded cases of COVID-19 in Nigeria, the likelihood of the federal government calling for the activation of OP Second 11 may not be ruled out. The force says it is also closed in all army schools and training centers. The army plans to also protect from looting all major food stores and government storage facilities.
Coming up, African stories. Angola confirms third COVID-19 case. Libya reports its first. And later, international news. Britain's Prince Charles tests positive for coronavirus.
You are watching ANN.
There is more within. Turn it up.
Welcome back. This is ANN News. Now to African stories. Angola Health Minister Silva Lutukuta has announced the third positive case of the new coronavirus in the country. The patient is a 23-year-old Angolan citizen who arrived in the country from Spain via Portugal last week. He has been hospitalized in a Luanda hospital. The country's first two positive cases of COVID-19 were announced on Saturday. The two men in their 30s were said to have entered the country around the same time with the third case. Meanwhile, the UN-backed government of Libya has announced that the country has recorded its first confirmed case of the novel coronavirus on Tuesday. This has raised concern that an outbreak could overwhelm the war-torn country's already weakened healthcare system. Many of the countries in the region, including Egypt and Syria, have imposed nightly curfews beginning this week. There are more than 30,000 cases of COVID-19 across the Middle East, most of them in Iran. Most of Africa has now registered some cases of coronavirus. The challenge for some countries now is how to acquire the medical supplies they would need to fight the virus. Africa Center for Disease Control, Africa CDC, is working to help countries who may be in need and have sent out COVID-19 test kits. Koleta Wanjohi has the story.
Procurement Officer Solomon Temesgen is sorting out test kits. These kits, provided by the Africa Centers for Disease Control and Prevention, are being sent to African countries grappling with the COVID-19 pandemic.
Last Friday, we shipped it to Nigeria and Cameroon through DHL, and for Djibouti, physically through their embassy here in Addis Ababa. So today, based on the preset distribution list, to be shipped to different countries, more than almost 26 countries.
Each kit can conduct 100 diagnostic tests. The Africa CDC is sending excess kits so that countries can stock up supplies.
Africa CDC is working on the supporting the continental efforts in stopping the transmission of COVID-19 around the public.
These are some of the 60,000 test kits that the Africa CDC will have shipped by the end of this week. But it says these are not enough. The Africa CDC says 3 companies have started manufacturing test kits. It hopes the kits will be available in the coming weeks, making it more easier for African member states to do more testing and better understand what they are up against. But there are concerns the process will take too long, given that companies manufacturing the kits are outside Africa.
Those tests still have to be shipped to Africa. We still need to place orders and then distribute them to countries there. So that is going to take a long way. And we are dealing with an enemy that is moving very quickly. The enemy is ahead of us, and we have to act quickly.
In the meantime, the Africa CDC is hoping a donation of medical supplies and equipment from the Jack Ma Foundation will help fill the gap. Each country will receive 20,000 test kits from the shipment, which arrived in Ethiopia on Sunday. Experts from the Africa CDC's emergency task force will also be deployed to countries that seek help. The institution has a pool of 40 medical experts on standby who can help with diagnosis and training. And as the continent awaits the much-needed medical supplies, Solomon works to ensure that whatever the Africa CDC has in stock will reach those countries in need in good time.
Swarms of locusts have continued to destroy crops in Kenya, putting millions of people at risk of starvation. The insects exploited favorable wet conditions after unusually heavy rains and invaded more than 20 counties. Experts now warn that climate change may worsen the situation. Wilkista Yabwa has the story.
Chasing these locusts is an exercise in futility. The loud noises and movements startle them out of their hiding places, but they are hard to catch. The large swarms cast a shadow over the earth, rising and then quietly falling back to their hiding places as if they never left. This is the predicament that farmers in Kenya's western region are grappling with as the swarms move southwards. The Rift Valley is Kenya's food basket. It is largely responsible for feeding the nation. But even this relatively cool area has not been spared by the desert locust invasion. In Nyigon village, 65-year-old Ruth B. watched helplessly as the insects invaded her farm.
They slept in the trees the night they arrived. In the morning, they descended on our farms. We had to move our cattle down. Everything now is at a standstill. Since they came, we've had nothing but problems.
We are worried. In this area, we depend on maize farming to educate our children and for our livelihoods. If the locusts remain, we don't know what we'll do.
With their livelihoods threatened, everyone had to join hands to help chase the locusts away. But their efforts were a drop in a seemingly endless sea of locusts. A section of farmers in Uasin Gishu County say the desert locusts have not wreaked much havoc on their farms, but this is largely because many of them are yet to sow this year's crop, and as more swarms continue to arrive, they fear that next year's harvest could be in jeopardy.
As long as the locusts remain here, we won't plant our crops because we will suffer double losses. We'll lose the seeds we plant together with the year's harvest.
It is a state of affairs that scientists say is unusual but not entirely unexpected, as the locusts move in search of suitable areas to lay their eggs.
There was very good vegetation, very high relative humidity due to more than usual rains, and the locusts have been moving from northeastern Kenya. As the winds were pushing, they really ride on the winds to migrate. They change with the winds all the way to western Kenya, part of eastern Uganda now. That's how the migration happened.
A desert locust swarm covering 1 square kilometer can eat the same amount of food in one day as 35,000 people. And this is why farmers heaved a sigh of relief when, a few days after they arrived in Uasin Gishu, the swarms migrated.
The same winds will now take these locusts as young adults, as swarms now to areas like Ethiopia, Eritrea, parts of Djibouti, South Sudan and Sudan. And they'll be finding a new crop because their cropping season starts in April. And that's now the danger, biggest danger in that area.
Government and non-governmental agencies have banded together to track the insects and spray them. Aerial spraying is considered the most effective control method, but it is a race against time as the insects continue to lay their eggs and multiply.
When we return, international news. Britain's Prince Charles tests positive for coronavirus. And later, sports. Man City manager Guardiola donates €1 million to fight coronavirus.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. On the international scene, news broke earlier today that Britain's Prince Charles has tested positive for coronavirus. A royal statement earlier today said the 71-year-old heir to the British throne has displayed mild symptoms and remains in good health. The statement also said the prince is self-isolated in Scotland. His wife, the Duchess of Cornwall, is said to have tested negative for the coronavirus. The statement also said officials have been unable to ascertain exactly from whom the prince caught the virus because of a high number of engagements he carried out in his public role in recent weeks. British Prime Minister Boris Johnson told his country on Sunday to observe social distancing and stay home as much as possible to curb the spread of COVID-19. It appears the people listened and are doing just that. Jemima Walker has the story.
Crichton is 72. He's recovering from an operation and has a weak chest. He's staying indoors because if he caught the coronavirus, it could be incredibly serious.
I was really quite ill last year. I had 3 bad chest infections. And if I got like that now and I got the virus, I would be extremely ill. And A, I don't want to be ill, and C, I don't really want to die.
Crichton is self-isolating. He's totally cutting himself off from other people because his health conditions put him at greater risk. It's why we can only speak to him safely on the iPad. It's also used for people who have the disease to stop them spreading it to others. He's got a close-knit community around him who've been helping him with tasks like shopping and getting his medication. But he worries about the effects on his mental health.
I'm quite anxious by nature, and I'm managing to keep my anxiety under control because I'm not in a bad situation. But But I think that people who live alone who are in a worse situation than me must get terribly, terribly anxious about when they take their medications, what to wash, what to rinse, what to touch.
Derry is a healthy and active 73-year-old. She's making sure she's at least 2 meters apart from other people, but is still going out to run errands.
No, I'm not nervous at all. You've just got to be sensible. I think if everybody's sensible, then this thing will hopefully go away more quickly. It's sense and reason.
This is social distancing. It's about minimising contact with other people and not socialising in big groups. It's why we're speaking to Derry at her doorstep, but at a safe distance. The government and health experts are stressing how important social distancing is in stopping the spread of the virus. They need to relieve pressure on the UK's National Health Service, something Derry knows all too well.
The health service, when I retired, was crumbling. And it's all very well for, I'm sad to say this, Boris saying, I wonder for the health service. Yes, but the minute you put pressure on, this sort of pressure on it, it won't work.
It's a rapidly changing situation, with officials issuing new advice daily. But the current guidance on social distancing is likely to stay in place for at least 12 weeks. The British government says ignoring this advice means the pandemic will go on for longer. And that would be a hard pill to swallow for Crichton and many others like him.
The Johns Hopkins University Center for Systems Science and Engineering in Baltimore, Maryland, says the number of confirmed COVID-19 cases in the United States has topped 50,000 as of Tuesday afternoon. The fresh figures reached 50,206 with 606 deaths. New York State has become the epicenter of the COVID-19 outbreak in the country, with 25,665 cases reported. The center says New Jersey has reported 2,844 and California 2,267 cases. To curb the spread of the disease, Washington, D.C. has ordered the closure of all non-essential businesses on Tuesday, joining a growing list of states and cities that are tightening restrictions on public gatherings. U.S. President Donald Trump said on Tuesday he wanted the United States to be opened up by Easter, which is just about 2 weeks away. There are warnings by medical experts that doing so would risk failing to contain the escalating spread of the coronavirus. Officials at the state level have been stressing the urgent need to focus on public health crisis rather than thinking about prematurely resuming economic activities. Italian hospitals have been swamped. The doctors now prioritize patients and all non-corona related cases have been pushed to the side. Now the nation is bearing down on its nationwide lockdown to bring the virus under control. Basically, everything in the country has shut down, and other than being out to get groceries, people need official authorization to move around or they would face steep fines. Reporter Hermione Kitson has the story.
As the crisis here deepens in Italy, the lockdown measures become more severe. Now all non-essential manufacturing activities have been shut down and all physical activity outside has been banned. Italian cities like Pescara have been quick to implement the restrictions in the hope of seeing results.
I close Pescara immediately, and so we are containing the virus, and this is the only solution to block and defeat the virus.
Announcing the measures, Prime Minister Giuseppe Conte said this was one of the country's darkest moments. The big question is, when will Italy start to see the effects of the national lockdown? In China, after 12 days, the number of cases started to stabilize. But here, after 2 weeks, the death toll continues to rise. Over the weekend, more than 1,400 people died from the virus, and the death toll continues to climb. Health authorities say this week is crucial in determining whether the country is managing to fight back. In the meantime, doctors are urging Italians to be patient.
This is the most important message: stay at home. Stay at home because it will pass.
But as Italy enters its third week in extreme lockdown, for many in the country, this crisis is still very much far from over.
Up next, sport. Manchester City manager Guardiola donates €1 million to fight coronavirus. Please stay with us.
You are watching ANN.
Welcome back. This is ANN News in Sport. Super Eagles forward Dayo Ojo and Abia Comets Benjamin Iluyo Made have been kidnapped while driving on the Benin-Owo Expressway. Ojo represented Nigeria at the 2018 African Nations Championship and at youth level with the under-17 in 2010. He's a long-term member of NPFL side Sunshine Stars, famously reaching the CAF Champions League semi-finals in 2012 before joining Enyimba in 2019. Ojo and Benjamin are also a professional footballer, were adopted while teammate Manuel James escaped. Barcelona forward Lionel Messi and Manchester City manager Pep Guardiola have each donated €1 million towards the fight against coronavirus. Messi's donation will be split between hospital clinic in Barcelona and another medical center in his home country. Former Barcelona player and manager Guardiola made his contribution to a campaign launched by the Angel Solidario Foundation and Medical College of Barcelona. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.